Perform hand hygiene and ensure privacy.
Hey, Mr. Smith.
Then introduce yourself to the patient and identify the patient using 2 identifiers.
Armband, please.
Before moving a patient, determine if the patient is able to fully or partially assist.
And can you give me your full
Assess the amount of weight to be lifted and how much assistance, if any, you will need. Consider the principles of safe patient transfer.
Hi, Mr. Smith. My name is Frank. I will be assisting Kim in moving you up in the bed.
Place the patient supine and the head of the bed flat. With 1 nurse on each side, adjust the height of the bed to a position that's comfortable for both of you. Remember, 2 healthcare workers are required to move a patient up in bed unless he or she can fully assist. Next, remove the pillow from beneath his head and shoulders and place it at the head of the bed, out of the way.
We're just going to have you put your arms across your chest. Just like that.
To place the draw sheet under the patient, turn him from side to side, extending the sheet from shoulder to thigh.
Okay, then you're going to roll back onto your back, over a little bump there, and come towards me. Okay, and go ahead and back on your back.
Then roll the patient back to the supine position. Now fan fold the draw sheet at his sides. To do so, firmly grasp the draw sheet near the patient. Then each nurse will stand with feet apart in a forward-backward stance, flexing the knees and hips. On the count of 3, both of you will shift your weight from the front leg to the back leg and use the draw sheet to move the patient up in bed.
Okay, Mr. Smith, on the count of 3, we're going to boost you up, and as we do, I want you to lift your head up, okay?
Okay.
1, 2, 3. Okay, fix your pillow. There we go. You can relax. I'm going to put your head up.
When you're finished, assist the patient into a comfortable position.
How's that? Better? Good.
To move a patient up in bed with the help of a friction-reducing device, you'll need to position it under the draw sheet. First, adjust the height of the bed, if necessary, and make sure you have enough assistance available. Remember, at least 3 to 4 caregivers is recommended if the patient weighs more than 71 kilograms or 157 pounds. Next, slip the pillow out from beneath the patient's head and shoulders and set it at the head of the bed.
Take your sheets down.
Going to lower your side rail.
Roll the patient first onto one side and place the device under the draw sheet.
Ms. Morris, I need you to go ahead and cross your arms over your chest for me. Give yourself a hug. I'm going to cross your right leg over your left, and I'm going to have you roll onto your left side.
You okay?
Yes.
Okay.
You're going to feel this hard plastic board underneath you just for a minute, though, to help us move you. Go ahead and have you roll back onto your back. Cross your legs again. Cross your arms across your chest again, and then I'm going to have you roll towards me a little bit.
Then roll her onto her other side and adjust the device beneath her. Return her to the supine position.
Go back onto your back.
Next, fan fold the draw sheet on both sides. Then you and the nurse across from you will firmly grasp the draw sheet with your hands close to the patient. The third nurse, standing at the foot of the bed, will hold the friction-reducing device stationary.
Mrs. Morris, on the count of 3, we're going to raise you up in the bed. And when we do that, I want you to lift your head up, put your chin to your chest, take a deep breath in, and exhale.
You and the other nurse who's lifting will then stand with your feet apart in a forward-backward stance. Be sure to keep your hips and knees flexed. On the count of 3, both of you will shift your weight from the front leg to the back leg and move the patient up in bed.
1, 2, 3. Now, we're going to go ahead and have you cross your arms again.
Remove the frictional device and make the patient comfortable.
Back on your back.
Hi, Miss Hankins. My name is Jane. I'm one of the nurses here. I'm going to log roll you onto your right side. I have 2 nurses that are going to come help. This is Lori and Yolanda. Right. Hi. I'm just going to raise your whole bed up here.
To log roll a patient, pad her knees by tucking a small pillow between them. Now cross her arms over her chest. Position 2 nurses on the side toward which she's going to be turned, and you stay on the side on which the pillows will be placed. Fan fold the lift sheet along the side of the patient that will be turning. One nurse will grasp the draw sheet at her lower hips and thighs, and the other nurse will hold on near her shoulders and lower back.
1, 2, 3.
On the count of 3, roll her as a unit in one smooth, continuous motion. Place pillows along the length of her back for support.
You can relax your arms.
And gently lean her back toward them.
Under your head. Just let your head rest down there.
As part of your follow-up care, record the procedure and the extent of the patient's ability to assist with positioning. Report your observations at shift change and document the times when the patient was moved during your shift.